Oh, this was one of my favorite tweets from over the weekend. From CNN, of course. A surprising new study found that the controversial anti-malarial drug hydroxychloroquine helped COVID-19 patients survive better in the hospital. Oh my gosh. First of all, why is it surprising? Well, it's surprising because CNN, its anchors, its website, has been promoting that Trump was reckless to be hopeful for hydroxychloroquine's success. Never said it was definitely going to be helpful. Here's what we know. Rooting for this drug to work for the last 3 months or so, 4 months now, meant hoping for more human beings to beat this disease and go home to their families. Rooting against this drug and claiming it was unsafe, as CNN and others did, because they associated it with Trump, was reckless and stupid and cruel. But that's, once again, you want to understand the depths of Trump derangement syndrome? Even when it comes to a drug that would be useful in fighting against a pandemic that is killing a lot of people in America and around the world, liberals couldn't get past. Trump says this might work, so let's convince everybody it doesn't. They might have convinced doctors and some practitioners not to use a drug that would have saved lives. So when you want to talk about the recklessness of the media, the costs of it, let's remember that it's not just in rhetorical terms. There's a cost that is well beyond just the fights that we have on Twitter and in cable news. Decisions are made based upon this information, based upon the narratives that are formed, the positions that are taken. And those decisions can mean very damaging and even tragic things during a pandemic. And then we have the mask chorus. Oh my, here we go. We have, what is this, Governor Murphy? That the mask requirement is, here, play clip 9.
But do you think that there should be a national mask requirement?
I do, Andrea. It's become almost not even debatable. Certainly when you're going out and absolutely indoors. As I mentioned, this virus is a lot more lethal inside than outside. But if you're leaving your house, put on a mask. I think it ought to be a national requirement.
A national mask mandate. This is where Democrats are now. Do you know where the thorough and conclusive study about masks preventing the spread of this disease exists? If you do, please let me know, because as of now, it does not exist. I've talked to you about this. Mask wearing goes back about 120, 130 years as a medical practice, and it's always just been kind of like an accoutrement of medical professionals, stretching back to when, yeah, it makes sense. You don't want to be, if you're close to someone, you don't want to spit on them or have, but you're really close to somebody when that's the concern. I have people running around here that want masks to be worn when I walk past them in a, 1,500 square foot office lobby, just walking past each other. Where's your mask? Why? It's just panic and superstition and control. Mandating mask wearing? If you want to wear a mask, wear a mask. Mandating other people wear it in outside of healthcare providers or with high-risk individuals in an enclosed environment, the science just doesn't support it, folks. It doesn't exist. Show it to me if I'm missing it. Hey, Team Buck, thank you so much for watching The First on YouTube. If you like this video, please click that little thumbs up button so then it will log as liked. And also, if you want to see more great content from The First, please click subscribe.